Good morning, everybody. We are interrupting your regularly scheduled programming with this breaking news. Monroe County health officials are updating us right now on a second confirmed case of COVID-19. As you can see, they're talking, so we're going to listen now.
Irondequoit Town Supervisor Dave Seeley and Vinny Esposito from the Governor Cuomo's regional office. We're also joined by the Greece Central School District Superintendent Kathy Groutman, Dr. Robert Mayo, the Chief Medical Officer and Executive Vice President of Rochester Regional Health, Dr. Manuel Matos, Chief Medical Officer of Unity Hospital, and Dr. Michael Apostolakis, Chief Medical Officer from the University of Rochester Medical Center. This morning, I am announcing that I have declared a state of emergency in Monroe County as a result of our second confirmed case of COVID-19. In the coming days and weeks, this will allow for the flexibility and quick decision-making necessary that will allow me to continue to fulfill my biggest responsibility, which is keeping this community safe. We first learned of the second case last night, and I must begin by again thanking Dr. Mendoza and his team of hardworking men and women at the Public Health Department. They are working tirelessly around the clock. They are working diligently, carrying out the critical work that informs all of the decisions we will make as a community. And last night was no different. They worked throughout the night to begin this new investigation and take on the painstaking task to contact tracing for this new individual. Our community is fortunate to have such an incredible, dedicated team in place. Before I hand this off to Dr. Mendoza to provide you with the clinical details of what we know and what we are doing, I want to take a step back for a moment. This is uncharted territory. As a community, we have never faced something like this in our lifetimes. I know that people are afraid and unsure about what is going to happen next, and that's okay. But what you see around me, this is Monroe County doing what we do best. We're coming together. We're working side by side with partners from across our area. This is something that communities are dealing with all over the world, and we are no different. We're taking this incredibly seriously, and I firmly believe that we, as a community, have an opportunity and a responsibility to come together and support one another. This is not a time for fear or panic. This is a time to help and care for one another, and most especially the more vulnerable people around us, our elderly and at-risk residents. I implore all of you to follow the medical advice that you've been hearing and will again hear today. Wash your hands often. If you can't, use hand sanitizer. Stay at home if you're not feeling well. Practice social distancing. Cough and sneeze into your sleeves, and call your healthcare provider if you're experiencing any symptoms. If you have elderly or vulnerable neighbors, please check on them. Make sure they have access to the care and supplies that they need. And if they don't, do what you can to help them stay safe and healthy too. Let's remember, this is how we as a community can come together. This is a moment that isn't about you and me. It's about the most vulnerable members of this community. This is new for our community. Things are going to be different for a while. We must be patient, and we must work together to keep our families and our community safe. I imagine a lot of you are going to have questions about school closings, and things are moving fast. We just learned about this case last night. Part of the reason why I'm declaring the state of emergency today is because I'm having conversations with school superintendents in the coming hours and days, and we want to be able to make decisions to act quickly. I also imagine there's going to be many other questions here today. I'll be honest with you, we're probably not going to have all of the answers yet. But what I can promise you is that our team will continue, and all these providers and all these experts we're standing here today, and experts across this community, are going to be working together to provide you with the most accurate, up-to-date information we have as quickly and as responsibly as we can share it. We're going to get through this, and we are going to get through this together. With that, I'm going to turn this over to Dr. Michael Mendoza.
Good morning, everyone. Again, I want to thank you for being here, for helping us to amplify the important messages that we're about to share with you today. Late last evening, we learned of the second confirmed case of COVID-19 in our community. We know that this is a woman in her 60s. She's currently hospitalized in stable condition at Unity Hospital. And we began the very detailed process of contact tracing, which means looking through all of the individuals that this person may have come into contact with to try to understand both her risk, the risk to her immediate friends and family, and obviously the risk to the larger community. Our investigation is still in its very early stages, but I can tell you that as of this moment, we have not been able to find a travel-related risk factor that explains how this individual has contracted this infection. And so therefore, I believe this is our first example of local transmission here in Monroe County. Again, our goal is first and foremost to protect the health and safety of our public. And that begins first by understanding how the individual might have come in contact with this infection, so that, again, we can help her to stay healthy, help her family to stay healthy, as well as to ensure that we can do everything possible to keep the community healthy. So in doing that, the first thing we must understand is the clinical course of the individual who we know to be confirmed with this infection. First of all, we believe that she had no contact whatsoever with the individuals under quarantine at SUNY Brockport, so we believe that this is unrelated to that. We also believe that our individual today had no contact with the individual that we talked about a couple of days ago. And so we believe that this is, again, a different and separate case from that. We believe that our individual today became symptomatic on March 4th, which means that we start going forward in time to try to understand all of the individuals that this person may have come into contact with beginning on March 4th and going forward. Again, it's important to note that with this infection, as far as we know, the more symptomatic a person is, the more likely they are to have symptoms. And so going forward from March 4th, we know that this individual went to work at Arcadia Middle School in Greece at 130 Island Cottage Road on March 5th and March 6th. We know that this was relatively early in her course of illness, that she was mildly symptomatic, which is somewhat reassuring, but I thought it would be important for everybody to know that there is this risk factor so that we can inform the public appropriately. Given that the last contact that this individual had with the student body of Arcadia Middle School, we believe that all of the students in that school, as well as all of the staff and faculty, must follow their symptoms for the 14 days following, which would therefore end on March 20th. We are, again, currently in the middle of our investigation trying to understand all of the other places that this individual was in our community. We know that she was beginning to feel less well, and so her exposures in the community decreased in the coming days. But we will be talking to her again today to try to understand any other identifiable risk factors that we might be able to offer you that will give you some guidance as to how to understand your own personal risk. The next step in contact tracing is going back in time, prior to when the individual became symptomatic, to see if we can understand where this individual may have contracted this infection. And again, we're in the early phases of our investigation, but as best that we can tell, one potential risk was that we believe that she went to church on March 1st at the St. Joseph Ukrainian Church in Irondequoit. I had the opportunity to speak with Pastor Weiner just now on the phone. I am very impressed by all of the precautions they have been taking at this parish, and they continue to take these precautions at this parish. I only mention this because it is a possible source of this infection for our individual. So with that, I know many people have questions about school closures. So I want to spend a few moments talking about school closures in general, and then offer some guidance to how we might apply what we know to the situation today. School closures are an excellent example of social distancing. They allow students to remain at a further distance from one another. We know that that is an important way to mitigate the spread of an infection throughout a community. And so when we think about undertaking school closures, there are three factors that we must consider. First, the timing. When do we conduct a school closure? Second is the duration. For how long do we implement a school closure? And third, the purpose. There are various purposes that one might want to achieve in undertaking a school closure. So let's start with the last reason, the purpose. Why would we undertake a school closure? First would be cleaning. to clean the premises, to make sure we've done everything we could to disinfect, to try to decrease the risk of spread in the immediate term. Absenteeism, if there are too many people who are ill that we cannot conduct business or teaching in a school, that would be a reason to close a school. And finally, and most importantly, is community mitigation, to try to reduce the spread of a virus through a given community. A second consideration is the duration. How long do we keep a school closed? One might undertake a short-term closure, again, to clean the school, or a longer-term duration to try to prevent the spread of the infection. And finally, and the most difficult perhaps, is timing. When do we decide that we think it's appropriate to close a school? The first consideration here is when is it relative to when we think there is local transmission in a community? Obviously, if there is no evidence of local transmission, there would be no reason to close a school. So for example, last year when we had evidence of measles in this community, we had no evidence that there was local transmission, so closing a school last year would not have been appropriate. Given the circumstances that we have now, we are beginning to believe that we do have local transmission, so I do think it is important to consider school closures. Another important consideration with regard to timing is at what point do we feel prepared to manage the unintended consequences of closing a school? So for example, if we close a school down and parents and the community are not ready to provide daycare, and all of the students all congregate at a church or a daycare center, we actually haven't accomplished anything, because we've taken them all from a proximate setting in their school and we've simply relocated it to a different setting. Along the notion of daycare, if parents are not yet prepared and the plan for daycare is to call grandma or grandpa to come take care of their child, we are potentially putting a more vulnerable group of our community at risk for this infection. And finally, we need to look at the external community. You know, what might the students do when they're not in school? Again, if they're going to the Museum of Play or to the zoo or to a sporting event, we would not necessarily have accomplished anything. So we need to make sure that we're cognizant of those factors as well. Obviously, we need to think about the schools and the impact on the educational program. We need to think about the impact on food, access to food. Many of our students receive food and other benefits by going to school. So we need to remember that there are other unintended consequences to closing down the school. And finally, and perhaps very important in this instance, is the impact on the workforce. If we have students staying at home, and therefore parents are staying at home, we have to ask ourselves, what do the parents do for work? And in this community, many of our parents work in the healthcare field. And so there may be an unintended consequence to closing schools down by potentially diminishing the workforce in our healthcare facilities. But given all of this knowledge that we know, and given what we have seen so far in the last 12 hours, it is my recommendation to the Greece Central School District to close Arcadia Middle School until March 20th. We will have further conversations about closing the schools, and while we do so, I want to call on all schools to continue this conversation, to consider all of the factors that I've just reviewed here, to engage in conversation with your parents, your communities, your faculty and staff, so that we can close schools, not if, but when we close schools, that we do so in a responsible and thoughtful fashion. I also want to encourage parents to think about what would the plan be for having your children not in school. What would the plan be for daycare? What would the plan be for the activities? Is there anything that we can do to prepare for that so that when and if this happens, we are prepared? And finally, I want to encourage my colleagues in healthcare to think about the impact on their workforce. If we have many of our team members or employees in healthcare potentially affected by the school closure, we're going to have to make some preparations in the healthcare setting to make sure that we have the adequate capacity to take care of people who are ill. So looking ahead, I want to encourage the public again to prepare. The way we combat fear is with facts, and we know that hand washing, not touching our face, coughing into our sleeve, all of the recommendations that you heard from our county executive still hold true today. Environmental precautions. We just learned a couple of days ago that there may be evidence that this virus lives on surfaces for up to 3 days. And so we want to make sure that we do everything we can to disinfect particularly surfaces that are in constant contact with people's hands, like doorknobs and railings, hand railings and elevator buttons and so forth. Again, I want to reiterate the importance of social distancing, looking at mass gatherings, reconsidering any gathering that is of 50 people or more. Those, again, are very important ways that we can mitigate the spread of this infection. And again, I want to pay special attention to nursing home settings and hospitals, because these represent the most vulnerable people in our community. In conclusion, I want to reiterate what the county executive said. We are entering some very unsettling times. This will be a time that will test us to see if we can adopt new habits in the face of an unending challenge that we face together as a community. I can think of no better group of people in this community to work together, to understand what we do not know, and to learn about what we can do to work together so that we can get through this process in a safe and healthy fashion. With that, I'm going to turn it over to the Superintendent of Greece Central School District, Kathy Grotman.
Good morning. Due to the state of emergency and the guidance from the Department of Health, Greece Central will be closing all schools moving forward until further notice. I'm asking our families to please follow the recommendations of Dr. Mendoza and the Department of Health. I can't say enough as a superintendent about the support, planning, and collaboration of the Department of Health and our county executive, Adam Bello. I know that our incredible team in Greece is currently working on future communication and further guidance for our families that will be shared later this afternoon. I would echo everything that our executive said and Dr. Mendoza said around working together as a community, and I have no doubt that we'll get through this and we'll continue to support our families the best that we can.
Thank you, Kathy. I want to ensure all the residents of the town of Greece that the town is taking all prudent measures to ensure your welfare. We are working together with Dr. Mendoza, the County Health Department, County Executive Adam Bello, as well as the State of New York, and all entities involved to make sure that all that can be done is being done. And I would just ask the residents to be a part of that, in so much as not only when we talk about hand washing and cleanliness for your own personal protection, but also for your neighbors. We can work together as a community to make sure we're in the safest environment possible. So heed the advice of all those in the healthcare professional that you've heard so far. If you have developed some symptoms, contact your own personal physician. Do not go to emergency unless your illness warrants that level of care. Immediately call your doctor. We want to make sure that the hospital, Unity Hospital in the town of Greece, is not inundated with cases when it's not necessary. Again, don't hesitate if you feel that you have some symptoms to contact your doctor. We together as a community can ensure the welfare of our fellow residents. And again, rest assured that the town of Greece is working with all the entities to make sure everything is being done possible to ensure the welfare of our entire population.
Good morning. My name is Dr. Robert Mayo. I'm the Chief Medical Officer of Rochester Regional Health. As you've heard, the first case of community spread COVID-19 was identified last night at Unity Hospital. The patient has received appropriate medical care and is stable at this time. The hospital leadership came together immediately last night to assess the situation and to begin the process of identifying potentially exposed employees and staff. We worked late into the evening contacting these individuals and providing them with the instructions which they need to be compliant with the CDC recommendations for healthcare personnel exposures while at work. I'm very pleased with the competent and capable work of the physicians and clinicians at Unity Hospital, and know that our ongoing partnership and leadership management is making a positive difference. I'd like to thank Dr. Mendoza as the Commissioner of Health and Executive Adam Bello for our close partnership, and we are committed to continue to work closely together day by day to ensure that the best care is provided for our community. Thank you.
I'm Dr. Michael Apostolakis. I'm Chief Medical Officer for the University of Rochester Medical Center. Since the novel coronavirus became a public health concern, UR Medicine System, along with the County Health Department and state and other officials, as well as our partners at Rochester Regional Health System, have been working hard to prepare for this impending pandemic. It's important to remember that the large majority of COVID-19 patients are not serious. The patient we told you about Thursday that was tested at Highland is still in isolation at home and doing well. None of his roommates are showing any signs of infection. That will be the case for the majority of the cases in Monroe County. For most patients in a reasonably good health, the symptoms will be mild. They'll have cold or symptoms similar to the mild flu, not requiring extensive treatment. As with the flu, the people at most risk for serious infection are elderly and immunocompromised patients. When patients with COVID-19 do require inpatient care, Strong Memorial Hospital, Highland Hospital, Rochester Regional, RGH that is, and Unity are prepared for this pandemic. We treat patients with infections every day. We know how to keep our patients safe and our staff safe. We use CDC guidelines, and most COVID-19 patients can now be cared for in private rooms only. With all the news reports and social media activity around COVID-19, people are asking us where they can get accurate information. I'd like to use this opportunity to ask the media to help with this by publicizing a few key resources. For detailed information about the disease, its symptoms, and what is happening nationally, the CDC website is the best source. To ask any general questions about coronavirus and what is happening in our state, the New York State Department of Health has an excellent hotline that's answered 24 hours a day. For Monroe County residents who have concerns or questions, Dr. Mendoza's office has excellent website, phone number, and email address. For you, our medicine patients concerned that they might have COVID-19, we have a special website with information about what to do. The most important message you'll hear on all these sites is that people who think they have COVID-19 need to be screened by a healthcare professional before going to a doctor's office, an urgent care, or the ED. And let me repeat that because it's so important. People who think they might have COVID-19 need to be screened by a healthcare professional before going to the doctor's office, an urgent care, or the emergency room. The vast majority of people who have a fever and sore throat do not have COVID-19. With a few screening questions, health professionals can help understand if there's risk and whether you need to be tested. If people do need to be tested, we have dozens of UR Medicine's locations that can safely evaluate you and take the sample for testing, including many of our UR Medicine primary care offices and all our urgent care locations. There are 2 state labs that are able to process these tests in a matter of hours, and by next week we expect to be processing tests in our central UR Medicine labs. Details about that will come out later this week. But the media can help us by emphasizing that no one should simply show up at a doctor's office or urgent care or emergency room and expect to be tested. Please call or email your personal physician's office or one of our resources first. Thank you.
Okay. Thank you, Doctor. And now we have time for a few questions to any of the folks who are up here can answer your questions.
Yeah, first off, I'd like to give a shout out to all the medicine staff here, all the doctors, nurses. We don't see at these press conferences for doing everything. Quick question. We're hearing that this woman who now has the second case of coronavirus, and this would be geared toward Dr. Mendoza, is potentially a nurse within the middle school. Can you confirm that, just so parents can be aware watching this of who their children may have come into contact with?
So I can confirm that she is not a nurse, and I will confirm that she is an employee of the school, but out of respect for her privacy, I will not disclose anything further. I think the most important message is to know that she does work in the school, and that people need to understand that and use that fact to assess their own risk.
This is for you or fellow, what time did you guys actually know about this woman, and why wait until 10:58 to notify the public?
We learned about this individual around 7 p.m. last night.
I'm sorry, when?
Around 7 o'clock last night.
And so why wait until right before 11 to notify us?
There's a lot of investigation that we need to undertake first. Understanding even the very basics of how this individual might have caught the infection. Our first and foremost goal is to ensure the safety of the public. And in so doing, we contacted probably 24 people last night to ascertain if there was anybody in our community who was potentially symptomatic also. And if that was the case, and currently we do not believe that is the case, we would have gone out and visited those individuals in their homes last night to put them under isolation. So I can appreciate the desire to understand the information, and at the same time we want to make sure that we're sharing information that's accurate and appropriate.
Can you go back to the identified, I believe, service of St. Joseph's in Runcorn on March 1st as a possible location where she could have acquired the virus?
You know, at this point we're very early in our investigation, but I did want to disclose that as a possibility.
And why would you think that?
Well, based on the fact that it was several days before she became symptomatic, and that's roughly concordant with what we know about this virus. And in speaking to the individual, we were not able to identify any other large gatherings where we think that it could have been likely.
Have you acquired any knowledge that anybody else at St. Joseph's might be showing symptoms?
We have not gotten that far in our investigation.
Dr. Mendoza, just want to be clear, are students and staff at the middle school or throughout the district going to be in self-quarantine?
At this point, I'm advising that all of the students, faculty and staff, and we'll be in touch with the school's superintendent and the staff at the school in more detail later on today to provide more specific guidance. But at this point, what I'm ready to recommend is that anybody who is in those schools, in the Arcadia Middle School in particular, on those 2 days needs to understand that they may have been in contact with somebody who was at that time contagious.
Was this person involved in any of the food services or any of the students' meals?
I'm saying that this person was very involved with the school student body, and so I think it's I want to protect the privacy of this individual.
So you can't confirm whether school prep or not, food prep or not?
I would say that this person was in touch with many of the students at the school.
Can you go back to the timeline of this? She attends the service on March 1st. When she realizes that these symptoms may be more than just a cold or flu, for people who want to maybe monitoring their own symptoms and looking at their own calendars.
So March 4th is when this individual reported that she was more symptomatic. As you all know, when you have a cold, sometimes we don't realize it until a couple days in. You might notice, sniffles or a little tickle in the throat, but typically fever or more significant symptoms are what might cue most people to the fact that this might be something more. And so that's the part that we're still trying to understand with this individual, but by her account, March 4th was when she felt more sick.
And when did she present herself to any kind of health care provider?
I think it was 2 days later than that. Our healthcare workforce is absolutely critical, particularly during a time like this. In healthcare settings, we utilize universal precautions, and so whenever we see an individual, we will take whatever precautions necessary given the clinical presentation for that individual. In this case, we want to take additional precautions, which is why it's so important for us to have a heads up as to when somebody with concern for COVID-19 might be coming into our facility, which is why it's so important for people to call ahead. And in this case, we'll don additional protective equipment, again, to protect our workforce. Now, what I will say is the greatest vulnerability to our healthcare workforce are the staff themselves. We need to ensure that our hospital staff, doctors, nurses, and so forth do not come to work sick. That is just as important as in healthcare as it is in any other field. And then again, the patients themselves. But a patient who we know to be ill is relatively easy to prepare for. It's those unannounced visits that we have to be very careful about.
Dr. Mendoza, if I get heard correctly, she first went to a doctor or some provider on March 6th?
Yes.
If that's correct, and why did it take the whole week to find out that she, what explains the whole week gap before you got to that back?
I haven't had a chance to review the medical record, but as a physician myself, I can tell you that sometimes those early symptoms are quite vague. And so that's all I'll offer at this point.
Do you know when the sample was collected from her?
It would have been 2 days ago.
2 days. So I want to ask you, I mean, Greece is its home. It's a very large community, but as we know, families, play dates, these communities are all intertwined. And this goes to Superintendent Robin as well. Why not look to cancel schools? I mean, based on the press conference yesterday, it was an if now, if then, you know, when would we cancel schools? Why are we just waiting until it's in another district to then cancel that school?
You know, I wouldn't say that we're just sitting around waiting. There's a lot of precautions that are being undertaken. And as I mentioned, there are many unintended consequences to closing down a school. And I think it would be irresponsible simply just to lock the door and have the kids not come in. I think we need to be thoughtful. I think we need to understand what are all the other things that might occur as a result of taking an action that is as drastic as this. And so I would challenge the notion that we've been waiting around. We've been having multiple conversations, very difficult conversations, asking very difficult questions, because the last thing we want to do is, you know, be the right solution to the wrong problem.
And so what about other public places like libraries, rec centers, or even gyms? Is it time to consider maybe closing some of those?
It has been time for some time. I think all of the people who oversee those types of facilities have been considering these questions for quite some time. You know, but it is a balance as a community. You know, what are the unintended consequences of closing a library? It means that people don't have access to books, and they don't have access to, you know, things that they might want to avail themselves of while they're under quarantine. You know, and then if the consequences that they all go to a rec center and congregate, then, you know, that would you know, potentially not be the right idea. So those are the kinds of steps that we have to think through as a community, which is why I think it's important that we, you know, we don't want to take too much time, but we don't want to make a rash decision at the same time.
So having that balance, we learned about this last night, going back to the facts you provided, learned about this at 7 p.m. last night. Why wasn't there an emergency press conference when play dates happened last night, when everything happened throughout the community? Why are we first learning that she was in the Arcadia district, in the Arcadia building at 10 a.m. this morning? I think a lot of parents and concerned citizens want to know that.
I can appreciate that. And at the same time, you know, again, our first responsibility is to the safety and health of individual people who we know to be at much higher risk, people who we know were in contact with this individual. And so we need to contact them first. And, you know, we are working as fast as we can. You know, our staff went home at midnight last night. And we're doing the best we can to inform the public of the risks that we know in a reasonable and appropriate fashion.
But once it was confirmed, how come not just tell people last night, late last night, instead of this morning?
You know, I guess I would say that I'm not sure how much would have happened between midnight and 6 a.m. today.
Do you think families could have quarantined maybe their students a little bit proactively?
Well, you know, we're doing the best we can, honestly.
Would you recommend that places that congregate close, places like rec centers, I know sports leagues have been canceled, recreational leagues have been canceled. Would you recommend that these places now shut down for a period of time?
I would strongly encourage them to consider whether to shut down.
Now, schools, attendance is dropping in schools. Parents and students are scared. So we've already seen Rochester Prep and a couple of schools shut down in the area. So do you suggest that the other school districts follow along? Is already dropping?
We are going to have a conversation very shortly after this conference to entertain that question.
Can you say, Dr. Mendoza, how many other tests are outstanding, waiting for results?
I think last night we sent off 8 or 9.
8 or 9?
8 or 9.
Were there any other confirmed or suspected cases of COVID in the hospital?
Not right now, no.
Do you know of any other people with symptoms potentially connected to this case?
We are not aware of anybody at this time who have symptoms related to this, but again, it's very early in our investigation.
You said after the first positive case that the risk in general in the community remained low. Does this case elevate that risk in general?
It certainly does.
How?
It increases the risk in our community.
And what action should we take as a result?
The actions are the same. Honestly, you know, the most important actions that we can take are the ones that we've been talking about all along. And I think now is the time to recommit ourselves to those actions. Hand washing, staying home if you're sick, that is the most important thing. I think the temptation to minimize symptoms early in an illness is something that we need to reconsider. Often, you know, and I think many of us in this room, very likely, will go to work thinking that we just have a little something that'll go away. I think now's the time to challenge that assumption.
One more question. Quarantine in Monroe County, please.
I'm sorry.
How many quarantine?
I don't have that number off the top of my head.
Ballpark, dozens?
Oh, we were at 50 the other day.
The person on the bus the news release that came out, it looked like you were tracking that person and 11 others. But were there more people on the bus? Was Rochester the end point for that? Or did you have to contact health officials in other counties or other people who were on that bus in New York?
So that investigation is also ongoing. We are responsible for the individuals who get off the bus here in Monroe County, and for the remainder of that bus route, both coming in and outgoing, we refer that to the State Department of Health for mitigation.
Where is this person living? This woman that is in Arcadia, what community?
All right, thank you all. We have to get back to work and allow the doctor to get back to his investigation. We appreciate you guys covering this and providing this accurate information to the public. When we have additional information to provide, we will obviously provide that to the community. So thank you all very much.
Where is she living?
I don't think we can disclose that right now.
I wouldn't be comfortable disclosing her place of residence.
Updates on the 4 people from the buses.
Okay. Yeah. All right, thank you all. Thank you very much.
Will speak to Superintendent Chapter, please.
All right, we just heard from Monroe County officials regarding a second confirmed case of COVID-19 in our area. There are 2 big announcements to come out of all this, that news conference that you just heard from. 1, Monroe County Executive Adam Bello has declared a state of emergency in our area. And 2, the Greece Central School District has closed all of its schools until further notice. Greece is doing that because the second coronavirus patient works at Arcadia Middle School. She's a woman in her 60s and is currently in satisfactory condition at Unity Hospital. An important note about her case: they do not believe it's travel related, which means she likely contracted it around here. That is different from the first case involving someone who traveled here from New York City on a Greyhound bus. That patient was identified earlier this week. Health officials say the woman noticed mild symptoms on March 4th and continued to go to school and interact with kids. When those symptoms worsened, she sought medical help and was tested. Right now, health officials suspect she contracted the virus at St. Joseph's Ukrainian Church on March 1st. They are encouraging all parents, and everyone for that matter, to engage in social distancing. For example, avoiding places with 50 or more people. The Monroe County Health Commissioner just told us that we could expect more closures at this point, so they are all encouraging parents to get ready to handle that. The kids will be home, so look into daycares or other means to watch them. That could have a significant impact on the workforce in our area. In all, this second case shows us that COVID-19 is in our community and it is spreading within our community. They did cut off questions, and there are many more that we needed to ask. For example, are we prepared for this number to surge? Do we have makeshift ICU units outside of the hospitals? We also have to ask if what we're seeing is a similar pace that we're seeing in other communities, other areas of the world, and what we can expect from there. They told us just 2 days ago that we can go out to restaurants, that we can go to the gym. Is that still the case? At this point, we have to leave that up to you. You just heard from the health officials in our area from URMC, Rochester Regional Health, and the Monroe County Health Commissioner. So at this point, you have the information and you have to make the best decision for you. Last note, COVID-19 is very serious. It does not appear to present a high risk for people who are young and have a good immune system, but the elderly and those who have a compromised immune system, this can be deadly, and it's something to keep in mind as we move forward. Speaking about moving forward, we have all the updated information that you need right at rochesterfirst.com. School closings, business closings, and much more. Click the Coronavirus Facts First banner at rochesterfirst.com when you get there. Thank you for watching News 8. We'll continue to update you with the latest on News 8 at 6.